Happy Sunday. I am Dr. Malea Jensen. I'm a family practice physician. I'm located in the United States in Iowa. I've been practicing for 27 years, a little over 27 years. I'm board certified family physician. So for those of you who do not know who I am. Where can I be found? We are live right now on YouTube and Instagram. I'm also on Facebook at Center Stage Primary Care. That is the name of my practice, Center Stage Primary Care. Otherwise, I am on all other platforms as IronLadyDoc. I'm on Twitter, IronLadyDoc, Instagram, IronLadyDoc, YouTube, IronLadyDoc. I believe I'm on Rumble, IronLadyDoc. So there's where some of the places you can find me. I have a new store for those of you who've been asking about apparel. There's a new storefront, and you can see in the description. For YouTube, I have that on there, as well as some tagged products. And then I will put it after the fact on Instagram. As a reminder, this is not medical advice. Yes, I am a doctor. You are somebody's patient, but you are not my patient. So this is for information purposes only, and maybe a little bit of entertainment. In order to schedule consultations, I do offer consultations, reviewing labs, reviewing medications, reviewing your medical history. All of that, consultations can be scheduled by emailing me at ironladydoc@aol.com. IRON, so Iron Lady, LADY, DOC @aol.com. And you can schedule consultations. If you have questions in regards to what labs that you would want your doctor to order, I can send you a list. There's no charge for that. There's also no charge for you to ask me to order your labs. No, your insurance probably will not cover it. You might have an HSA that would cover it, but otherwise, I'm not associated with any insurance companies, and so that might be on you to pay for those labs. But I can at least give you a list if you want me to. But if your doctor will not order them, I can order them for you. All right, just email me. There's certain states that they don't allow outside for you to order from outside labs, but hopefully you're not in one of those 6 or 7 states. I think that is it for getting started on any information. I thought I would put that all up front. But this is your opportunity to ask medical questions. Please keep it in that realm, and I would appreciate that. I do have a question that just came in. Would you explain more about rusting from the inside out? Linda asked this question, and it's a good question. Oxidation and rusting are like synonymous, okay? And that is a process of aging. That is why we have this big talk about antioxidants. Antioxidants like glutathione, vitamin C, vitamin E. We think of antioxidants to take care of the oxidation that's going on in our body. Oxidation is simply aging. Now, aging can be fast, it can be moderate, it can be slow, but everybody and everybody's cells is aging inside. When we look at things that oxidize or cause rapid aging, one of those things is glucose. Glucose has a tendency to glycate. When glycation occurs, a sugar is binding to a protein. I like to give the example in our skin because you can think through this. There are proteins in our skin, elastin and collagen. And so whenever we have spikes of glucose or just constant amounts of glucose in our bloodstream, that sugar binds to proteins all over our body, our eyeballs, our skin, our heart, everywhere we have protein. We get a condition called glycation. It gums it up. It causes that protein to become sticky and really not usable, okay? The end product, when A, glucose, plus B, protein, binds, the end product is called an AGE, advanced glycation end product. It is an age, it's aging us. Other things that can cause advanced or accelerated aging is oxidation via iron that's trapped in our body. Yes, we need iron. It is essential. We need iron in order to function, our cells to function. But sometimes we can get too much, and maybe too much of the wrong kind that can't be absorbed. When that happens, that particular oxidation is iron oxidizing, which is rusting. And if you have known about putting a piece of iron outside in the rain and the humidity, you'll see that it starts rusting right away. We are rusting inside. Now, hopefully we have enough antioxidants to help take care of it, but we're breathing in all kinds of toxins. We're eating toxins. We don't sleep for recovery. We don't get outside in the sun for recovery. We're doing a lot of things wrong, or that is not in our antioxidants' best interest, okay? And so that is how I would explain rusting from the inside out. You can't see it, but a lot of times we can see oxidation or glycation outside on our body. We just are so used to it and we don't think anything of it, or we chalk it up to genetics. Let me give you an example. Skin tags. I can see skin tags a mile away, so I can see them across the room. Skin tags are a sure sign to me that that person has insulin resistance. Insulin resistance is high insulin and insulin resistance, okay? You have to have both of those things in order to really be insulin resistant. And that is due to elevated blood sugars. When blood sugars go up, insulin goes up. If we're constantly eating, insulin is constantly high, and it stays high. And insulin being a growth factor, it causes cells to grow, including skin cells. So skin cells of a skin tag or thickening of the skin on your neck, that thickening of skin is due to high insulinemia in the blood, high insulin in the blood. People will say, yeah, but my dad had those. Exactly. Your dad was also hyperinsulinemic. He had insulin resistance. You will note that if you lower carbs, you lower blood sugar, you lower insulin, and the skin tags start disappearing. This can be dangerous because insulin causes all cells to grow. Skin cells, heart cells, cancer cells, all of these cells can grow in the presence of insulin. We need insulin. You would die if you didn't have it, but we have way too much. A good insulin level is 3 to 5 in the fasting state. Okay? All right. Hopefully that answered Linda's question, but if you have more, let me know. Let's see. Jayco says, how do we know if iron is blocked in our body, blocked or trapped and not absorbed? You can get lab tests. One, I would get a serum iron level. I would get a ferritin level, a transferrin, a TIBC, and a saturation. That is the iron studies. You need a CBC. You need a CMP. You need your thyroid checked. There are a lot of things that play a role in determining whether or not you might have signs of iron trapping. But let me give you a physical sign. A physical sign of iron trapping might be discoloration on your skin, the age spots, okay? Age spots that you're, let me see. We don't have a moderator here, so if you guys can help me out by pointing out, or having problems over there. So 1910, if you see anything over there, I'd appreciate it since you're here all the time. Let me see. Since I don't have a moderator, it's going to take me a little bit to clean out some of the others. And I do apologize for those of you on Instagram. So once we get those labs, Jayco, you can have somebody evaluate them, whether it be me or somebody who's like insulin, or excuse me, metabolism IQ. Dr. Christie can go over those labs with you. I don't think she is online right now, but that would be an option for you to get those labs and have one or both of us review those labs with you and talk it through with you, okay? That's how you can get a better handle on what's going on. Let's see. David says, yes, 1910, you're exactly right. The pigmentation or that thick nigricans around your neck that you see on some people, that is a definite sign of high insulin. Those two skin changes for sure. But as I was mentioning to Jayco, another thing that you can look at is this, I want to say, darkened skin changes on your skin. We like to call them liver spots. Those are a sign of hyperinsulinemia, okay? And are also a sign of iron overload. I can look at people who have hemochromatosis. They'll have the hyperpigmentation of the lower legs. Their hemosiderin deposits is the other name for it. And I know those are big terms, but you can see, I have men who are on testosterone who show these signs early on. Their hemoglobin's high, their hematocrit's high, their iron is high, their ferritin's high, everything is high on these people. And they show discoloration of their lower legs. And it's pretty evident. Okay. David says, life is great. Life is a great school, and you don't need a degree to understand what you learn. I agree, David. You could probably run circles around half the doctors who've got these medical degrees that we have as a medical degree. You probably, years ago, could have ran circles around me. David says that type 3 diabetes is not talked about very much. I would agree, but it's getting more prominent in discussion. James says, why 50 years ago, no problem, but now is of the scale? Why 50 years ago, no problem? What was no problem 50 years ago? Help me out. Yeah, David, I agree. We're starting to give names to things. You know, you have type 1 diabetes, you got type 2 diabetes. Many people think that they're very similar. They are not. Type 1 is not enough insulin, and type 2 is an overproduction of insulin. Type 3 has been given to Alzheimer's. Hit home with some people. PCOS is also a type of diabetes. I agree with that as well. Are you affected by the snowstorm? We did not get any snow. Well, we got a dusting, but it did not. It was just the cold. What is metabolism? Metabolism is the process of building up and breaking down. So it is anabolic and catabolic. So that's what metabolism is. Gilbert's syndrome. What about it, Matt? Gilbert's syndrome. Usually you'll see high bilirubin, isolated high bilirubin. If it's just isolated like that, Matt, it might not be a problem, but I would want to look at other things, other functions of your liver. I would want to know an insulin level, and I would want to check your iron studies. Those can all go together. Let's see. MJ is commenting on probably because, why things have changed as of 50 years ago. So you guys probably are talking about the more and more insulin resistance, or in fact, more and more diabetes that's arising. And that is, I mean, part of it is due to the production of high fructose corn syrup, but genetically modified fruit with fructose and glucose in it. None of the foods are the same as they were 50 years ago. There's a lot of, like MJ says, a lot of garbage that we're eating and we think of it as food, but it is not food. It has no nutritional value. Okay. And yes, we are getting glyphosate from in our soil, heavy metals in our soil. They're in our air. They drop into our soil. We're eating the things that are grown in the ground, and that can be a problem over time. Thank you, 1910. Okay, Matt, that's good. High indirect billing. You have to look into your other labs as well and make sure, get your other liver function and get iron studies as well. Check thyroid. All of it can be related. If you're having a problem with bile production, otherwise known as cholestasis, all of these things can play a part, and I would want to know all the context. Melanie asks, what labs do you recommend with lower leg purplish shiny skin tone? That just right there indicates to me that arterial or venous changes are occurring, and you would probably want to not only get a venous duplex, but an arterial duplex. A normal cardiovascular consult, was it with a vascular surgeon or just a cardiologist? They all have their specialties. And yes, the duplex is an ultrasound, and yes, I would probably get those. Okay. Good question. Thank you. Shane asks, hello, doc. You might have answered this before, but are fruits good or bad for breakfast? Good or bad? Are you asking for me or for you? Because if I was answering for you, I would say no one should be eating fruit because everybody has insulin resistance. A majority, not everybody, a majority of people have insulin resistance. 90% of the population, 85% of the population is insulin resistant. If you are insulin resistant, you have carbohydrate toxicity, which is elevating insulin and causing the cells to become resistant to taking in any more energy. So consuming fruit or any sugar, fruit is glucose and fructose. It might be similar to consuming a Pop-Tart or cereal, especially today's fruit. I can't get on board with putting that fructose and glucose in my body. Now, if you're asking, is breakfast better than lunch or supper? Yes. That would be the best time to consume it in hopes that your exercise will make you a little more insulin sensitive and take care of it. But again, if you want a surefire way of adding to liver fat, consume fructose and alcohol. John, I understand you're not trying to be rude, and I understand your concern in regards to your statement. And I don't think, I don't know how to answer you, to be perfectly honest. Marjorie says, if you need help with these things, find a naturopath. Okay. So Matt says that his ALT is 55, goal is 10 to 15. His AST is 45, goal is 10 to 15. Already, I would say, yeah, globulin, albumin, all of these are high. Matt's got some liver disease going on, likely fatty liver disease, likely fibrosis, needs a fibro score or a fibro scan. Probably would need to also check for signs of cirrhosis. So seeing a liver specialist would be in Matt's best interest. I would definitely get a fasting insulin level and an ultrasound or a CT scan of that right upper quadrant. That's where your liver sits. But yeah, you got some things going on there, Matt, that you need to see your doctor about, okay? John says, does the beginning stage of insulin resistance, including needing to pee all the time and burning when urinating? John, I would suggest to you that you might be past the stage of insulin resistance and likely more so full-blown diabetes. For my definition of diabetes, it's an A1C greater than 6.0. You need to look into that, okay? That can be a serious thing, and diagnosing insulin resistance or diabetes in the earliest stages is in your best interest. Can sugar being excreted through the urethra cause burning? Yeah. When sugar is high, remember that bacteria and yeast can be high as well, and those things can cause burning. Insulin can increase the size of our prostate, and that can cause problems. So all of these things, John, needs to be looked into with a good set of labs. Melanie says, yes, it was a vascular surgeon. Ultrasound was done. Are there any other labs to recommend? A full set of labs would be in your best interest, Melanie, and I would be happy to send you a list if you email me at IronLadyDoc@AOL.com. Okay? Shelley says, good morning, Dr. Iron. Thank you for being here today to educate me. Glad to see you, and thank you. You're very welcome, Shelley. I appreciate your support and for you being here. Marjorie says, great advice on the fruit consumption. Thank you. Shane says, thank you. What would you recommend we consume instead in the morning, if not fruit? Are eggs good? I suggest that eggs with extra yolks, some bacon or steak would be in your best interest. Cook it in tallow and butter. But yeah, eggs are definitely the best. I would probably skip the toast and other things that go alongside it, but a good amount of scrambled eggs and some steak, ground beef. My favorite meal, in case you're wondering, my favorite carnivore meal is ground beef with scrambled eggs. It is my go-to. I eat it every day, at least 1 or 2 meals a day. That's how much I love it. I do love steak. I love bacon. I just don't like to cook it. So therefore, I pretty much have left that out or eat it only on occasion. I will eat some fish, not a lot. If I do eat fish, mostly during the week, I will consume sardines. They're high in omega-3s, and they're also high in vitamin D. What else do I consume? I will do a minimal amount of cheese, and not every day. I do a minimal amount of cottage cheese, not every day. I do a minimal amount of cream, heavy organic cream, raw heavy cream, most every day. And probably an ounce, I would say, at least 2 ounces, I would say. Let's see. Relax says, Dr. Jensen, how do you justify the rise in ApoB and LDL on a long-term carnivore diet, even if inflammatory markers are low. Well, I don't justify anything, but I could maybe help you understand what is happening on a carnivore diet when ApoB and LDL go up. How about that part? I'm not going to justify anything. We are all learning. And I think a problem we get into is stating that the science is already done. We come to something, we come to know something, and we say, you know what, done deal. We're all good, and I'm going to sit back and I'm just going to justify everything that I learned and tell you why you are wrong and I am right. And so relax, I don't want to do that. It's not in my best interest and it's not in your best interest because it seals off any ability for us to continue learning, including myself. So I will tell you how or why I think ApoB and LDL go up, okay? You have to remember, or as you already remember, ApoB is a protein that is attached to every LDL. LDL stands for low density lipoprotein, and attached to every LDL is an ApoB. Triglycerides even have ApoB, okay? An LDL that has an LDL that has an ApoB and also that has an ApoA is called an LP little a. So all LDLs have an ApoB. So they ride hand in hand together. If LDL goes up, you're going to see an elevation of ApoB. Now, initially, or even long-term, on a carnivore diet, you're going to see perhaps more LDLs being formed because there is more things for them to shuttle around your body and then get recycled through the liver. These LDLs, particles, I would suggest to you that you want to break them down, okay? Break them down into the size of the particles. If you have large, buoyant, large LDLs, those are carriers of many things. They do many things in our body that help us. It is small, dense LDLs that arise from being glycated. They are small and dense and sticky. They are more prevalent in high carbohydrate diets that raise glucose. Remember, glucose glycates proteins, gums them up. So if an LDL has a protein on it called ApoB, it is in fact a small dense lipoprotein with an ApoB. It's going to get glycated. And that glycation causes that LDL to be sticky. It'll cause cells to be sticky. Glycating on the cell membranes causes them to be sticky. It damages them, it injures them, and it attracts all kinds of things to come in and help fix things. It could be white blood cells or red blood cells or platelets or any of the other things that come in and try to help cells and the lining of arteries recover. Marjorie says, oh, hopefully that answered your question, relax. Marjorie says, eggs with greens is a good breakfast. For Marjorie, that is a good breakfast for Marjorie, okay? Hopefully they are cooking their greens to remove some of the, oh, you gotta boil them instead of cook them. You wanna get rid of those oxalates, the phytates. Those are chemicals that are in, natural chemicals that are in greens. That's one of the reasons why I personally avoid all plants. Elfie asked, do you believe in LSD therapy? I know nothing about LSD therapy. And therefore, I can't believe in it. or not believe in it, or recommend or not recommend it. But if you're talking about the drug, I personally choose not to put any drugs in my body. Ultra asks, wait. Let me make sure. Yeah. Ultra asks, will a 100-hour water fast cure many issues? Ultra, I would ask you, what are you doing a water fast for? What are you personally doing a water fast for? Where did you get the 100 hours? Is that something you just made up? Did you hear that that was the sweet spot? Let me know, because I'm sincerely curious. I don't know, because I don't know how to answer your question. And so if you can give me more information on why you would do a water fast, like what is it that you are seeing or heard or read that it would give you benefits, okay? Oh, Lixa, thank you for the, is it a super, okay, it's a super chat. Thank you, Lixa. I do appreciate it. I appreciate you guys doing the super chats, the super thanks. It keeps this channel going. It's the little things like that make me very happy, and it's very rewarding for me that, you find that my information can be helpful to you. Matt says, ultrasound is clear. I do heavy weight training and consume supplements like whey. So whey is processed protein, a milk protein. It's processed. It's denatured amino acids. It spikes blood sugar, which spikes insulin and could increase your risk of getting fatty liver disease. A lot of times, radiologists will not comment on fatty liver because it's so prevalent. So the radiologists have actually stopped noting it in their interpretation. So your ultrasound being clear means did not see it or saw it and did not comment on it. So I would want to know what that ultrasound said, and I would ask specifically if the radiologist saw fatty liver, because your liver enzymes are very high, okay? They're over 3 to 4 times elevation. Taking in omega-3 fatty acids, over-the-counter omega-3s, by the time you get them, they're rancid, which means they're oxidized. Polyunsaturated fatty acids, omega-3s, are oxidized before you put them in your body. So you're actually increasing more and more oxidation. So it might be in your best interest to eat whole foods, get rid of the whey, get rid of the omega-3s. I suggest that you probably don't need vitamin D. I don't know how much fat you have on your body, but if you do have fat on your body, vitamin D is likely stored there. As you lose fat, the vitamin D will come into the bloodstream and will be picked up and used. Now, not all stored vitamin D can become active, and so you need to be aware of this. I never felt any pain or causes of the liver until it's too late. You likely will not see side effects of fibrosis or fatty liver disease until you are in stages of advanced cirrhosis. So, Matt, I would probably get a fibroscan, and I would probably check into some other things. I would probably see your doctor. Oh, Marjorie, thank you. As a reminder, you guys, if you find that these live streams are good and informational, please hit the like, hit the thumbs up, subscribe, push all the buttons. Do the clickety clack for me, would you? It really helps the channel. That it doesn't cost you anything. to hit those buttons. You don't have to give any money to do that. You don't have to spend any money. Shelley says, what do you think of vitamins, like the one magnesium oxide? When I hear people say that they need vitamins, I would suggest to you that they are synthetic and that you should get them from your foods, whole foods. I would also suggest to you, when somebody says that they need vitamins, it tells me that their diet is lacking. Their diet is not nutritionally dense. Therefore, they need to supplement with vitamins. Now, granted, much of our diet, even if we're eating whole foods, can be depleted because of the soil, because of the air, the chemicals. It's playing a role in how much nutritional value we can get from even whole foods. So before taking something like magnesium oxide, which magnesium oxide is mainly used for constipation. Not a lot of it is absorbed and usable. So that would probably not be the one I would choose for overall increasing magnesium levels. But before you go there, I would suggest to you to get a red blood cell magnesium level. You don't want to be taking any supplement without knowing the level of where your body is prior. So if your RBC magnesium level is normal, there's no reason to be taking magnesium. I would be looking for some other things. Doomer says, hello, sending love from Poland. Hello, Poland. Thank you for being here. I appreciate it. What time is it there? Where are you guys listening from? What city, what state, what country? I would like to know. Jerry just finished an 85-hour water fast. It heals your body. How did it do that, Jerry? What did you feel on an 85-hour water fast? Karen says, what do you think of the pee test advertised on TV where you can pee in a cup and Karen, I don't watch much TV, very little. And so what is it that they are testing for? Peeing in a cup, what are the, I don't know what they're testing for. Do you have any information on that? Marjorie says, thank you for sharing. In July, my husband lost 80% of his pancreas, necrotizing pancreatitis, and now I have to learn about nutrition fast. Yes, Marjorie, you do. How did your husband get necrotizing pancreatitis? Oh, relax. That is a beautiful question. Is the physiological glucose sparing seen in keto patients truly benign, or is it a precursor to peripheral insulin resistance? I can answer your question, and I know this is gonna just make you really mad. I don't think we have an answer to it. Here's what I can say, just thinking through it, relax. When we are in a ketogenic state, our pancreas does not have available what we call a precursor insulin. We don't have like a ketogenic, low carb, no carb, carnivore, lion diet person does not have pre-insulin to be secreted when you eat something. Even if it's ketogenic, even if it's a steak, you're going to raise the glucose a little bit, right? And so initially, a ketogenic person could look like anything they eat raises blood sugar. But you have to take into consideration, what is that rise? Did it go from 70 to 85? Or did it go from 70 to 150? Okay? It's important to know where your sugar levels are and also how fast they come down. Because a person in ketosis does not have that pre-insulin secretion. Initially, their blood sugars could look high, and then they drop down with the secretion of insulin, the secondary secretion of insulin. Now, with that being said, any spike of glucose, I believe over 90 to, let's just say 100, let's keep it, if we spike our glucose over 100, you're getting glycation. So I don't know if I know how to answer your question in regards to physiologic normal glucose sparing. If that is answering your question at all, okay? If I'm not, please add more to your question. So I might have answered it completely or answered the question completely wrong. I don't know, but I was thinking that's what you're asking. Maybe not. Jerry says, I will send you the video on what it does to your body. Too much to explain now. Sounds great. I look forward to watching it. Marjorie says, I will consider what you have said about eating plants. Good. Ultra says, Benazati said on YouTube that a 100-hour water fast is beneficial. And I'm not doubting that Benazati said that. Could you send it to me? I would love to watch it. I would love to learn, because it sounds like Jerry on Instagram also recommends this type of water fast for, 85 hours and felt wonderful. I just don't know. And I would love to learn. So if you could email me or message me, email might be better. Email me that link. I would love to learn about it. I don't watch Benazati, all of Benazati. I mean, I've watched some of his YouTube videos, but not a lot. Doomer says, greetings from Poland. Do you know a trick to reduce headache from strong flu? So you got a viral infection. A lot of times, and I don't always promote this, but a lot of times high dose vitamin C and magnesium help. A magnesium, like an Epsom salt bath, helps. The headache is just from virus particles, inflammation. You got to know that your viruses are eating whatever food you're putting into it. So this might be the one time you should be fasting and not giving sugar to your body for those viruses. You need to starve them. Chicken noodle soup, warm broth. And why is that? Does it have to do with the electrolytes? We're usually dehydrated when we have the flu. We get a fever and we lose a lot of our water to the atmosphere. It's, that can cause a headache. Kim, this question was actually asked yesterday as well. What do you think about medicinal mushroom coffee? I don't know enough about it to think about it. I used to use mushroom powder in my drink or coffee in the morning, and I don't anymore. Mushrooms grow in the ground, and I gave up consuming in my body anything that grows in the ground, minus one thing. It's called coffee. I do get an organic low oxalate coffee, but yeah, it's still a plant and it still grows in the ground. Let's see. It is very kind of you to share such useful. You're very welcome. Thanks for being here. Please share it. If you find my information informative for you, and you know that maybe a friend, family, or coworker might enjoy listening, please, share it with them. Hitting the like and the subscribe buttons help. So if you might think that you already are subscribed, but you know what? Oh my gosh, there's so many times that we get very rude people on here. It's just unbelievable. But we are -3 of our blue wrenchers, the moderators today. So I'm having to look through, and I'm looking for cues and for questions. That helps me point it out, okay? Super chats and super thanks will be answered first. That's how we do that. Is there a correlation between the lymphatic system and high insulin? High insulin is from high blood sugar, okay? However you can get blood sugar elevations, that's how high insulin occurs, all right? Is in an inflamed lymphatic system a result of, could high insulin increase inflammation? Yes. Could the lymphatic system get inflamed? Absolutely. There is much to be learned about our lymphatic system. And if there is a topic that no doctor talks about, it's our lymphatic system. It is so important. And I'm getting more into where I feel more comfortable talking about the lymphatic system. But if your lymphatic system is not working very well, your immune system, your ability to filter out things it's hampered tremendously, okay? We need to shuffle fluids in and out from our bloodstream through our lymphatics and back and forth. And if there's one thing, I'm trying to think of the term. It just slipped my mind, but if it comes to me, I'll expand upon it. I'm trying to lose weight. My PCP started Zepbound. I'm sure your PCP didn't start themselves on Zepbound. They started you on Zepbound. I'm up to 7.5 milligrams. I'm supposed to eat 140 milligrams of protein or grams of protein. I would probably need some more information. If you want to consider a consultation, just email me at IronLadyDoc@AOL.com. Okay. Ultra says a 100-hour water fast helps with insulin resistance. I'm guessing that a 24-hour fast in general will help with insulin resistance. A ketogenic diet will help with insulin resistance. To minus water for 100 hours might not be in everybody's best interest, Ultra. What would be the difference between 100 hours and 24 hours? I realize that if we do not take in water, our body will start to make physiologic water. Our body makes physiologic water. We as humans likely have a lot of pathologic water in our body. When we go into a ketogenic diet and insulin drops, it will start to release a whole bunch of water and salt for that matter. And that water that is released is pathologic. We didn't need that water. It was causing problems. Physiologic water our body does need. Our cells need water. So our body will make water. However, I will tell you that anything I believe, this is personal, I believe anything over 72 hours is not healthy. I don't think that anything over 48 hours is healthy. I've tried 48 hours. Well, I didn't try. I didn't have to do anything. I chose to do a 48-hour water fast when I was bodybuilding. And if that was miserable, okay, I'm just going to tell you right off. I don't know how you guys are doing it. Thank you for the gift. And I do have a Patrice, thank you so much for your gift of that is much, you say much appreciation for sharing and enlightening us. I appreciate you too. And hopefully you got my information, Patrice, that I sent you an email on. So let me know if you did not get that. Ryan says, what if we want the opposite? Opposite of what, Ryan? Help me out. Kayla says, I need some information on how to lose weight, 73-year-old, 100 pounds overweight, diabetic, on Zoloft, blood thinner, blood pressure meds, and Jardiance. I have high cholesterol. Kayla, if you haven't already talked to your doctor, I would do that. If you would like to have some more coaching from me, you can consider signing up for a consultation at AOL.com. IronLadyDoc at AOL.com. And I'll send you some forms and you can fill those out and send them back, and then we can schedule a consultation. And I can act as your doctor coach to help you ask the right questions or ask questions to your doctor, your primary care. Everybody should have a primary care. Okay? Jane says, can he use ALT and AST to monitor liver function? Yes, but I would also get a GGT, and I would look at, you know, your CO2 levels and your CMP. I would look at your CBC for sure. There's a lot of things you need to look at. Ultra says, having a diet of eggs, meat, and sardines. Is that you, that you're doing that? You drink herbal teas and water. Okay, good job, Ultra. Hopefully you are healthy, wealthy, and wise. You're skipping down the street singing the happy song, and you're sleeping well at night. D. Fields asks, what are recommended foods to eat a week before colonoscopy? I would, maybe not so much, well, I mean, it just depends on how fast your transit time is, but I would stick to things that are easily absorbable, and, you know, eggs are 100% bioavailable. So I would stick to eggs and cottage cheese, things that are easily broken down. I would definitely not do plants like vegetables, and I probably would avoid, you know, steak and meat. They are, even though they are absorbed almost 100% in the small intestine, your colonoscopy does not go up there. It only goes through the large bowel. So again, D. Fields, if you're worried about it and you've had previous colonoscopies that were, maybe you were unsuccessful at getting yourself cleaned out, I would, if it was me, I would stick to eggs and cottage cheese. Homes by Julissa says, do you do online consultations? I do. Thank you for joining. If you're not already subscribed, please do so. But yeah, I do online consultations. You can email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. AOL.com. El Mexicano is, are you listening from Toronto, Canada? Thank you for being here. Kayla's listening from Atlanta, Georgia. Welcome. Ultra, that sounds great. Sheep cheese, beef, eggs, and which are with soft, runny yolks. That sounds awesome. You're very welcome, Shelley. Thank you for being here. We're going through and eliminating some comments that I feel are not. Let's see. Shelley, we handled that one, so thank you. I appreciate you being here. Shelley, thank you. I really appreciate it. Matt's giving us a little more information. Matt, I have to ask, are you on, you said you're a heavy lifter. Are you on steroids at all? Kayla asks, what is wrong with plants? Plants are things that grow in the ground, and our soil is depleted of nutrients. Our soil holds a lot of heavy metals and glyphosate. Plants have natural defense chemicals that I personally choose to avoid. They could have oxalates or phytates or seraphanes, tannins. I personally think that the phytosterols that are in plants are not something that my body thrives on, and I try to avoid plants. Now, if you're, living well and doing, not showing advanced stages of aging, rapid advancing stages of aging, maybe plants are fine for you. But personally, because of everything I've read, I choose not to consume plants, with the exception of my coffee. There was a video that came, it was Dr. Anthony Chaffee, and it was a lecture series on plants are trying to kill you. And if you guys have not watched that on YouTube, Plants Are Trying to Kill You by Anthony Chaffee. The next day, after seeing that, it was a few years ago, after seeing that, I stopped eating plants completely. Thank you, Mark. Oh, relax. Good question. And I see that you used a different word here instead of justify. You used reconcile. Oh, relax. You and I would probably have interesting conversations. Okay. Dr. Jensen, how do you reconcile the activation of mTOR pathway via high protein intake on a carnivore with the longevity benefits of autophagy? Okay, to many of you here, that is a very complicated question, and I will try to be very simplistic. mTOR is it is a marker of rapamycin. Okay, that's maybe too deep. All right, let's start over. mTOR is a growth molecule. We need mTOR in order to grow. If mTOR is high, insulin is high. Insulin is also a growth factor. It causes things to grow. mTOR grows cells, muscle cells, fat cells, any cell, cancer cells. Insulin grows muscle cells, fat cells, cancer cells. mTOR being high physiologically, like when we're growing and when we're pregnant, physiologically, mTOR needs to do its thing, but it also needs to come down. Anytime we eat, anytime, no matter what it is, mTOR will go up, okay? Insulin could come up as well. Maybe not as much, depending on what we eat. Now, if there is one food that increases mTOR more than another, it would be carbohydrates. People who eat constantly of carbohydrates will constantly have mTOR activation. When mTOR is up all the time and never has a chance to come back down, autophagy cannot occur. What's autophagy? Autophagy is cellular cleanup. Autophagy and breakdown of that is mitophagy, which is cellular or mitochondrial cleanup. We go through stages. We should go through stages of building up cells and breaking down cells. And we need to clean up the stuff that has been broken down. Now, some of it we can be reused, and others it's like taking the trash out, where we can't use any more of those parts. The question by Relax is, how can I reconcile mTOR on a high protein diet? Well, I would rather activate mTOR by high protein, especially high protein and fat, which comes naturally, then I would want to activate mTOR with carbohydrates. The minute I eat or consume carbohydrates, I'm going to be hungry again. mTOR does not have a chance to come back down in that time period. If I eat again in 2, 3, 4 hours, mTOR likely would not have been able to come back down. mTOR constantly elevated, no autophagy is going on. So Relax says, bringing up high protein. Do I eat high protein? No, I eat moderate amounts of protein. And I eat moderate amounts of protein and even higher amounts of fat. I would, knowing what I know now, I would never consume a protein only, high protein and no fat. I've done it before when I was bodybuilding. All it does is increase our risk of protein poisoning, rabbit starvation, basically. And I try to avoid that. I didn't even know it was a thing when I was bodybuilding years ago. So my idea is moderate amounts of protein and moderate to high amounts of fat, even in a 1-to-1 or 2-to-1 fat to protein. The fact that I eat this way, I'm satiated. So for instance, I haven't eaten yet today. That fasting brings down mTOR. No matter what you eat, let's just say you had all carbohydrates. If I fast, I'm going to bring down mTOR. The more ketosis, the more ketogenic I get, mTOR is going to come down. If I fast, that's the fastest way to bring down mTOR. Don't eat. Don't eat for 12, 24 hours. In some of you guys' cases, 48 hours. That's going to bring down mTOR. When you eat again, then you eat a moderate amount of protein with fat. mTOR goes up, you get satiated, mTOR comes down. Relax. Does this answer your question to your satisfaction? Hopefully it does. And hopefully I explained it in such a way, that people who don't even know what mTOR or even insulin is, those are growing factors and we need them. We just don't need them on all the time. And we don't need them in extreme levels because we will never get to a point where we're, catabolic and renewing cells, autophagy. Okay. Yeah, Virginia, thank you for being here. So Relax, hopefully I answered your question. Please let me know if that helped. And that question, Relax, I can't answer. And you know who would be the best one to answer that question about the downregulation of the PDH complex would be Richard Smith and Ben Bickman. I would look into that. Those are right now not in my wheelhouse that I would be even remotely able to talk to you about that pathway, okay? Again, Relax, if you're wanting to know more about this lipid energy model, I would definitely look into David Feldman and read some of his research on lean mass hyperresponders. But again, right now I'm writing on the fact that ApoB is going to go up because of LDLs going up, and that LDL that goes up on a carnivore diet, especially in lean mass hyperresponders, that LDL is going to go up, ApoB is going to go up, but those are large, buoyant LDLs, and they are not small, dense. Their insulin levels are low, and they are you can get a calcium scoring test, and you can see as well, okay? And then get serial ones, meaning in 2 years, recheck it again and see if there's increasing or decreasing. Relax says, again, I think these questions are very complicated for the average listener, but can chronic carbohydrate restriction lead to a decreased thyroid function? I believe that the decreased thyroid function is in conjunction with a healthy ketogenic diet. okay? We don't need as much T3 as a person who is eating a high carbohydrate diet. T3 is needed for metabolism of carbohydrates. If there's no carbohydrates on board, less T3 is needed. Now, if there is a problem with a peripheral conversion of T4 to T3, where's the T4 going? Did you get a reverse T3 to see if there's a problem with the T4? Because if the T4 is not converting to T3, it's got to be going somewhere. I would look at a reverse T3. You might even want to look even higher up. Do a thyroid scan. What is the iodine level? These are all things that you can look into. Home by Julissa said, I did my blood work, show I have high, low density. Should I not do? Again, Julissa, you might want to consider a consult. I'm not sure that I understand. Thank you, Andreas, for following me. I really appreciate it. For those of you who do not know, there is a live fundraiser going on right now on Instagram. It is for rescue, rehab, and rehome. That is where I got my Norman Tallow. I rescued him from rescue, rehab, rehome. It is a local rescue in the Des Moines area that I support. And so for my live streams, I do put them and try to raise money for them because they mean a lot to me. I find that they are all right. And relax. If you want to schedule a consultation, I'd be happy to go over some of these things in more in depth. Melanie asks, can Hashimoto's be treated, improved with medicines? You mean like thyroid medicines? Hashimoto's is having antibodies to your thyroid. So what caused an elevation of antibodies to your thyroid? If you have one autoimmune disorder, you likely have more than one. And so I have seen dramatic reductions in thyroid antibodies, TG and TPO, on a carnivore diet. Okay? So, without medicines. Yes, Melanie, that's what I was just talking about right now, is by lowering the amount of carbohydrates in your diet, the inflammatory carbohydrates, you can lower your thyroid antibodies without medicines. But talk to your doctor. That's a good question for them. Angry vet. Gosh, if you are a veteran, thank you for your service. And I'm sorry if you are an angry person. Sorry about that. I'm just looking at your handle. I saw a video stating technology is causing kids not wanting to read anymore due to AI and ChatGPT. It's like they don't feel the need to. Do I have thoughts on it? I think it starts with the parents. If the parents feel this way, getting their kids reading books, you have to actually buy them books. I mean, the real book where they can feel the pages. They need to get away from the constant need to be on the computer. It's not good for us. It's not good for anybody, but especially kids. Their brain development is slower and could be diminished. And it's something that I would have to look in depth more. Angry vet, but I think it starts with the parents. You can only control your kids. We can't control other kids. All right. If you have kids in your life, buy them a book. If they don't read it to them. Ask them if if you can read it together. That's something that it's a sad thought, actually. Richard, I don't know much about radioisotopes in food, but thank you for asking a question, and thanks for being here. IM says, what do I think about Zepbound for sleep apnea? Most people who have sleep apnea, it's due to their obesity. And when weight loss occurs, the sleep apnea usually resolves or gets better. I would suggest to you that if you are over 300 pounds and you're morbidly obese, you did not lack Zepbound. You do not have a deficiency of Zepbound. You have a overabundance of something else. Now, if your Zepbound was for a jump start, 30 days or so, but the fact is there's nothing about Zepbound that is going to change the reason why you got morbidly obese, okay? The minute you go off of Zepbound or Wegovy or Ozempic, which is the same thing, Trulicity, Mounjaro, which is Zepbound, the minute you go off of these things, if you were using them for obesity, you will likely gain that weight back, if not more, because your diet never changed. You never thought about the things that got you obese in the first place. Those things need to be healed. There's nothing about Zepbound, which is a GLP, usually produced, majority is produced in our gut. When we are obese, when we age, GLP, which is Zepbound, it's GLP and GIP, it goes down as we age. It goes down in obesity. So it seems logical that if I just give it back, it's going to improve my whatever it is. In this case, your obesity. I'm not arguing the fact that Zepbound works. It does. But you're also causing other problems. You could be increasing fat cell hyperplasia. Big word meaning more fat cells are going to be produced. Zepbound, Wegovy, Ozempic, Mounjaro have been shown to increase fat cell hyperplasia. Now, for many of us, that could be a great thing, but not in a person who has risks for obesity, because if while you're on Zepbound and you're losing weight because you're basically not eating, you're feeling full faster because gastric emptying is slowed. It also tells your brain that you're not hungry. So you're going through you're blocking normal physiologic changes. And when you go off of that, even if you wean off of it, the fact that Zepbound, Mounjaro, Wegovy have been shown to increase fat cell production, and you've never not learned in that time period to learn how to eat, you will go back to the same foods, you will be ravenous. And you will fill up not only the fat cells you had, but the ones that you just formed. And so now there's a possibility to gain more than 300 pounds and be more morbidly obese. There are certain people who have the ability, it's usually in white people, have the ability for fat cell hyperplasia, where they just can continue to get gigantic. You can say, oh my gosh, isn't there a stopping point? They just keep getting bigger and bigger and bigger. Unfortunately, that person is at risk of fat cell hyperplasia. They have a rarity that they're actually making more fat cells, and they can get extremely 600 pounds obese. There are cultures like Southeast Asians who have very little ability for fat cell hyperplasia. And so since they don't have as many fat cells, they get diabetes and insulin resistance and fatty liver when they're skinny. Whereas a white person who's got more fat cells may not develop insulin resistance or fatty liver until how many fat cells you have in your body. All right. This goes to show you that people who do liposuction, they're actually taking out fat cells. So you're leaving yourself with less fat cells. So if you're continuing to eat the exact same foods, you're going to get fatter in different places than you were fat before. And that could be fatty liver or fatty butt or fatty tongue or fatty, fat where you didn't want it to go. It's going because you're consuming the same foods thinking, well, I'm just going to I got rid of all that fat. No, you did not. You're actually setting yourself up for the fat cells that are there to get even fatter. So if you didn't take anything off of your butt, you just took it off of maybe your belly, then your butt's going to get fatter. And the backs of your arms are going to get fatter, and your liver is going to get fatter. It has to go somewhere, you guys. When insulin is up, you will get fatter, okay? Okay, thank you, 1910. Yeah, it's very rude. Yeah, and I do pray for RM and Lucy. I have not heard from RM. I don't know. It's been, last Sunday was the message from RM that they were going to the emergency room, and they were not here yesterday, and they're not here today. I have not heard from Lucy or Linda today, so I do pray that they are well. You're very welcome, I am. Thank you for being here. Hi, Daryl. Thanks for being here from Chicago. You're very welcome, I am. I'm glad you're here. Yeah, Kayla, there is a charge for consultation. My rate is $110 an hour. And if you're interested in that, email me at IronLadyDoc@AOL.com. Thank you, Zamello. I appreciate that. Thank you, One Divine. I appreciate you. So Matt is completely natural, meaning they're not taking, he or she, well, Mr. I'm guessing, so he is not taking any steroids. So again, this really needs to be looked at. Your liver is at risk, okay? Let's see. Kayla is saying she does a 16/8 split for fasting and seen some slow weight loss. Is there a good for a senior citizen to continue? Is this good for a senior? Well, all right, Kayla, are you needing to lose weight? If you're needing to lose weight, why would just being a senior citizen alter the fact that you need to lose weight? Okay. I'm in Iowa. Denver, I think you said this last time. You're seriously considering a. Okay, Smothered, let us know how that goes for you, okay? Hopefully, are you going to change your handle? Because right now you're Smothered Pork Chops. So if you're going to stop eating meat, you might want to change you might want to say Smothered Broccoli or Smothered Asparagus over rice. Change your handle and let us know it's you, okay? John, I'm not familiar with MS and the medications. I would talk to your neurologist about it. If you want to talk it over with me, consider a consultation. And you can email me at ironladydoc@aol.com. Thank you. Frank says, I've noticed late in life that I'm unable to process meat fat, as opposed to what other type of fat, Frank? Yeah, I agree. I've heard other people tell me this, Frank, that, oh, okay. Actually, I've heard the opposite, Frank, that people who are carnivore actually have little to no body odor, acne, and bloating gas. It's people who eat plants that have these problems. But you might be a rarity, Frank. Let's see. Kayla says, do I have a trick to get off the love of sugar? You're addicted. It's hitting your dopamine receptors. Cold turkey is the best way. I do not eat any grains or rice for 3 years. Yep, I agree, 1910. You can't just take in a little bit. It's just like an alcoholic. You know, would you tell an alcoholic just have one drink and quit? No, you have an addiction. You're hitting your brain. Kayla, your brain has insulin resistance. Your brain is starving. That's why it's telling you to eat. You're choosing the wrong food. If you were to get rid of sugar, you're going to go into a withdrawal, just like any drug, that could last 48, 72, even 4 days, 72 hours, even up to 4 days, 5 days. It doesn't feel good to some people, but you can do it. I would make sure that you're drinking enough water and also consuming good mineral salts during this early transition time. You could also start, Kayla, with adding some exogenous ketones, like Keto IQ. I think it's Keto IQ. There are types of ketones that you might want to consider, whether it be an ester or a salt or an acid of the ketones. But sometimes people who do exogenous ketones, you can get them on Amazon or wherever, they help that transition for your brain. So because it could take Kayla 72 hours up to 4 days to start making ketones because her insulin level is so high. It's so high. So a lot of times I will tell people, if they're like a Kayla, and I'm assuming that Kayla's insulin is very high, I'm just going to assume, we're just giving Kayla a diagnosis here, and we're going to assume that the insulin level is high and it's going to take days to get her down. Maybe adding in some exogenous ketones to feed your brain will help. You know, the most important is beta hydroxybutyrate, BHB. That is the most important ketone that we can have. So pre-feeding with ketones until your body kicks in would be in your best interest, Kayla. Kayla, you know, many of my people, it's not how many consults. A lot of times, the information I give during a consult, it's an hour long or however long you want to talk to me and answer your questions. I mean, most of my clients don't return for 3, 4, 6 months. It's not like a chiropractor. I didn't say that. It's not like a doctor where you got to keep coming back. I'm helping you review your labs. I'm helping you review your medications, your diet, your sleep, how many LED lights you're around, all of these things, everything about Kayla we talk about. And I don't think that requires multiple visits to give you the idea that, yeah, I really need to make some changes. But sometimes people need to review their labs and they're a numbers kind of a people, okay? And they need to see those numbers and know what they mean and see maybe in 4 months, are they coming down or going up or whatever it needs to happen. Kayla, that is what I'm here for. I'm trying to help coach you, but I don't want to be where you need me in your nest all the time. I'm in your back pocket. You can consult with me anytime, but we need to get you so you're figuring out what got you to the place where you're at right now, okay? Because the reason you're here is because you want to make changes. $19.10. Yep, you're right. You know, when they make food. 1910 says, I ate most of a package of strawberry wafer cookies last night. I should have not have brought them home from the store. Correct. But you did. And so 1910, you need to stop beating yourself up and move forward, okay? You need to move forward, and maybe you consider fasting today. And maybe throw the rest of the package away, just up to you, and go exercise, get on a regular exercise program. Don't go to the store when you feel times of vulnerability. That is a surefire way of caving to the dopamine in your brain. It only made you feel guilty. I can tell by the sad crying face that you gave me in your text. The guilt and the beating yourself up is basically a survival mechanism, and it's not good for you. It's not good for your health at all. So it takes extra strength not to get those things at the grocery store. So I'm telling you, stop going when you feel you're in a vulnerable position, okay? Devin says, I have so much skin issues. That's likely coming from your gut. Remember, when we have leaky gut syndrome, things that are inside of our bowels move to the outside, and the most common place for those toxins to go is in our skin. And so you go to the doctor and they treat you with harmful medications. Yeah, they might help your skin issues. However, what is causing the skin issues in the first place? And it's usually the gut, and it's inflamed, and the zonulin level is high, and your gap junctions are wide, and things from the inside are going to the outside, and you're seeing the repercussions. Some people see it in their skin, some people see it in their joints, but going on these medications is not always in our best interest, okay? Patrice says, I found it very helpful by ordering groceries. So she's ordering online, because then she's not tempted to buy all the sweets at the grocery store. It's hard to pass up on the cookie dessert aisle. That's funny. But great idea. I love those ideas. Does anybody else have ideas to help curb giving in, or to these whims where we go and we sabotage ourselves? Devin says it's 90% my body. What do you mean by that? 90% your body? Of course it is. Virginia asks, what do I think about taking probiotics? I would ask, what are the reasons to take a probiotic? What are your reasons that you would even consider taking a probiotic? To take a probiotic tells me that your bacteria are not healthy. Then I would say, why aren't your bacteria healthy? Okay? Why aren't your gut bacteria healthy? Why would you need to take more probiotics? If you say, well, I just got done with, or I'm taking an antibiotic, maybe you could consider a probiotic. Make sure that they're refrigerated, because simply taking a capsule at room air, that's not real probiotics. They're already dead. I don't know that they're going to do much for you. You can do kefir, whole kefir, whole plain kefir, however you want to say that. So whole milk would be in your best interest if you're on an antibiotic. But taking them on a regular basis, I can't see. Okay, RM, we were just talking about you. We are glad you're here. I have a question. My classmate accidentally forgot. They took it the first dose. They passed out 3 times in a row and said they were fine, just tired. I don't know what the medication is, but if you are concerned, you likely need to call the ambulance, RM. Yeah, you might want to consider calling the ambulance. I don't know what they took. Yeah, I would be concerned too. For those people who are listening and they're praying people, we're going to pray for RM's friend, classmate. And RM, we hope that you're fine as well, okay? You know, last weekend you were telling us that you're going to the emergency room, so we were thinking about you, RM, and people have asked about you. So please stay well and let us know if we can help. Melanie says, after indulging in sweets, get up right away and move around. Walk up and down stairs, move your arms, help move glucose out of the bloodstream, and it might ease some of the guilt. That's a great idea, Melanie. That is a great idea. So after 1910, ate nearly a whole package of strawberry wafers. I don't even know what that is, but it sounds horrible. But yeah, Melanie, getting up and moving, running up and down, walking up and down stairs, getting muscle activation will help push some of that glucose into the muscle glycogen stores. It could help. You're exactly right. And it could help with the guilt. Absolutely. I can see where that might help people, right? Okay. So even after meals, I think it is warranted to go for walks, get outside. But sure, getting some of that blood sugar into the muscles, if we have muscles, not everybody has muscles, then there's not much of a glycogen store. RM says, I am okay. I ended up going to my primary care doctor. I just have to get more tests done. Okay. Well, if we can help RM, let us know, okay? Kayla says, are your consults on the phone or video? I do video consults. I want to see the person. There's only been one in the last year. I've only had one who did not want to do a video consult with me. They wanted to just do the telephone. And that's fine. I'm not going to push that. 1910 says, I love that advice. Thank you. So Melanie, 1910 says, thank you very much. Great idea. We love it. Thank you. Tell us more about exogenous ketones. Oh, geez. Okay. From a simplistic point of view, why do we want ketones in our body? Why would taking ketones be good for us? Ketones, or being in a ketogenic state, when our body is burning, I don't want to say burning, it's breaking down our fat, our fatty acids convert to ketones. Ketones are an energy source. They're worth about, and take this with a grain of salt, about 4 calories per gram. So they're very similar to a carbohydrate, but a carbohydrate can get stored because it raises glucose and spikes insulin, then insulin pushes it into the cell. Whereas ketones, we breathe them out and we pee them out. They're an energy source that's almost like in and out of our body, okay? So ketones in general are an alternative source of fuel. A majority of people, they're insulin resistant. We've already acknowledged that. They live on carbohydrates. So they are using carbs as their fuel source. If you get into a state of ketosis, you don't go through all of those stages that glucose needs to go through. Your fatty acids, either what you eat or what are on your body, will break down or convert to ketones that's used as an energy source. Our brain loves ketones. Our heart loves ketones. Our body loves ketones. All right? It prefers ketones. Ketones are also they're unaffected, not affected by insulin. You cannot get into a endogenous, your body making ketones, if insulin is high. But you could take ketones, and it doesn't matter what your insulin is in your body will use those ketones. it still doesn't solve the fact that your insulin level is high. Does this make sense? Your insulin level is high because you're eating carbohydrates. And you can never make your own ketones if your insulin is high. Insulin has to drop way, way, way down in order for your body to make ketones. But if you say, but doctor, I really want to, I maybe can't change my diet. I love my carbs. I'm not going to change. I'm telling you right now, well, you admit it. Okay. Will ketones help me? Brain will use them. Your heart will use them. They might even take those ketones before they take your sugar. But when they run out of those ketones, they're going for the sugar. Make sense? Ketones are very anti-inflammatory. They decrease inflammation in your body. They support your mitochondria. Your mitochondria, those powerhouses, they love ketones. They would rather have ketones than glucose. Ketones also modulate neurotransmitters. Examples of neurotransmitters are serotonin, norepinephrine, dopamine. If ketones are helping to modulate neurotransmitters, they could increase GABA, which is parasympathetic, or glutamate, which is sympathetic, but ketones play a role in neurotransmitters. Historically, ketones, and you can pull up PubMed for this, ketones help seizure disorders, okay? A simple ketone that you could take if you have seizure disorders, if you have cognitive decline, using MCT oil is kind of a cheaper way. It's not the greatest, but MCT oil, an organic MCT oil, because that is most typically C8, carbon number 8. It has 8 carbon chains. It's a medium chain triglyceride, MCT. It's a little larger than an ester, or a little better than an ester. MCT, medium chain triglyceride oil. Coconut is an MCT. Coconut oil is an MCT. It's 8 carbon chains, maybe 10 carbon chains long, okay? So MCT might be a little better than an ester, a ketone ester, but a salt of a ketone is better than an MCT. And an acid is probably the best. It's probably preferred. So the best ketone supplement would be the acid form, and then the salts, and then the esters. But I will tell you this: the acid form of ketones is very rare, and it's unstable. They degrade quickly. They can cause an upset stomach. The difference between an ester and an acid is the acid is completely void of being bound to an alcohol. As esters, they're highly bioavailable. They slowly clear from your body, like upwards to six hours. The bond is hydrolyzed, but they can be bitter. And they become costly. And they can also cause GI upset. So ketones can cause upset stomach. I believe ketone IQ is more of a precursor to get your own body to make more. Now, I don't know if that has been studied in seizure disorders or cognitive decline. But if you want to first try MCT oil, and see if that C8, that 8 to 10 carbon chains helps with production of endogenous ketones, give it a try. If you want to simply use MCT as an energy source, it's a great energy source. Medium chain triglycerides or short chain fatty acids, they are meant to be burned. They are meant to be burned. It's the long chain fatty acids that take longer to break down, and they go through stages of the breakdown. How about that? Okay. Melanie says, I just had a spoonful of honey to help with immunity. Why? Are you telling us that your immune system is bad? That you would put fructose and glucose into your system to increase your immunity? Or are you sick and you're taking some turmeric and mushroom and honey and apple cider vinegar concoction and drinking that or spoonfuling that because you are sick? But to simply take fructose, glucose as a help of your immunity, in my logical thinking, you're actually raising your blood sugar levels, which raises insulin levels, which actually decreases our immune system's ability to work. So I don't know, Julissa says, we're having really bad weather in New Jersey. Oh, I'm so sorry to hear that. Yeah, we didn't get any snow. I'm guessing when you say really bad weather, you're getting a lot of snow. And I'm sorry to hear that. But stay safe, stay warm. It is very cold in Iowa. We had a really bad day on Friday, but today and yesterday have been a little bit better. But just dress warm, stay home, prep, make sure you have water and food. Backup generator. Those are really important things to have on that East Coast right now. Kayla says, does MCT oil need to be refrigerated after opening? It does not. Dennis asks, I have a 348 platelet count. Is that dangerous? I would want to look at everything else in conjunction with that platelet count, okay? Why is your platelet count high, elevated? And what does that put you at risk for? Does it put you at risk for clotting? Are they sticky platelets that are going to lead to a clot in your arteries? And then that clot gets thrown to brain or heart? You need to figure out why your platelet count is elevated, okay? Yeah, I understood, Melanie. Melanie was clarifying that following a teaspoon of honey, she went up and down the stairs for 3 to 5 minutes to get that glucose or fructose into her muscles or wherever she was wanting it to go. But my question to Melanie is, why do the honey glucose fructose in the first place? If you are simply doing it because of your immune system, I would say to you, what is wrong with your immune system? Okay? Your immune system, God-given immune system, does not have a switch that says deficient in honey, must take some in order for immune system to work. Okay? Okay. Minister Stayfly, just so amazed at the level of information that you have. Well, thank you. Love from Chicago. Happy Sunday to you in Chicago. Hopefully you're staying warm as well. Thank you. Thank you for the compliment, but I spend a lot of time reading. I spend a lot of time listening to other providers, whether they be doctors or chiropractors or nurses or trainers. I spend a lot of time, maybe too much time, educating myself. It sometimes gets overwhelming because I have so much in my head that I can't even organize it all. And that's why sometimes I feel flustered answering questions, like maybe from Relax. I believe that was the handle, because there's so much going on in my head that it's difficult to organize. And so you guys asking questions helps me to organize it a little bit better. So I appreciate that. Okay. All right. Any other questions, you guys? It is Sunday. It's a blessed Sunday. As a reminder, if you cannot get your labs ordered by your physician, you can email me at IronLadyDoc@AOL.com, and I can order those for you if you're not in certain states. But again, your insurance will not cover those labs. If you want a list of labs that you can ask your doctor to order, hopefully they will, and you don't know what some good labs to get, just email me. And at IronLadyDoc, IronLadyDoc @AOL.com, and I'll send you a pertinent list of labs. No charge, you don't have to pay me, but I can send those to you. All right? If you want to set up a consultation, as I just said, email me. Okay? But I am here every Saturday and every Sunday for live streams. Saturday at 9 a.m. Central, Sunday at 10 a.m. Central. And then I do reels during the week. So I would appreciate you, free of charge. It doesn't cost you anything to like and subscribe and hit the thumbs up and hit the share buttons. Do all those things. It helps me. RM asks, what does an iron saturation at 7 mean? Why is it so low? Likely, it is a sign of iron overload, iron dysregulation. That is a better term. RM, it is a sign that the iron in your body is not regulated. It's iron dysregulation. It's not moving to and fro like it should be. It might be trapped. It might be in all the wrong places and we can't use it. And so if iron saturation is low, you need to look at your serum iron. You need to look at your ferritin. And I would get a hepcidin level, hepcidin, HEPCIDIN. And you can even get a ferroportin level. And this would give you more information on why your iron saturation level is so low. You might also want to get a RBC copper level and a vitamin A level. If copper is low, vitamin A is low, iron is going to be shuttled into the liver cells, the hepatocytes, causing and leading to iron trapping. This type of movement we don't want. We do not want iron trapped in our liver. This could be indicated by a low iron saturation, but you would need to get other labs in order to look into this. Okay? Yes, Kayla, I definitely am. I love Jesus, and Jesus loves me, and Jesus loves you, and Jesus loves everybody listening, whether or not you love Jesus or not. Okay? Oh gosh, Melanie is expecting 19 to 23 inches in Massachusetts. Oh my goodness. Melanie, are you going for the Patriots or the Broncos today? Just asking. Holmes by Jalissa says, are there people that would not benefit from a carnivore ketogenic diet? No. And the reason I say that is because there are absolutely zero, goose egg, zero essential carbohydrates. Plain and simple. Okay? Let's see. Sasa says, vitamins for better vision, diabetic changing diet to no carbs, looking for reversal of bad vision. Let your blood sugar, if you're changing your diet, so you're eliminating or significantly reducing carbohydrates, which diabetes is carbohydrate toxicity, just like alcoholism is alcohol toxicity. You are changing your diet. I'm guessing you're changing it to a ketogenic diet, which is low or no carbs. Okay? It will take time for your eyes to heal. I'm hoping that you've had an eye exam by an ophthalmologist looking for any diabetic changes in your eyes with the optic disc, with the arteries. You can look in the back of your eye when you dilate your pupils. You can use a special magnifier, a special microscope, so to speak, that looks through and into the eye and look at the backside of your eye. But all of the arteries can show signs of diabetes. It's something called nicking. And nicking can be a sign of diabetic changes even before a doctor sees your diabetes changing. It's unfortunate that we have to have eye problems and seeing a ophthalmologist before your doctor, your primary care physician, notices that you have likely insulin resistance. Should have been checking labs way in advance. And unfortunately, your ophthalmologist is the first one that finds out that you got diabetes. Melanie, I knew you would laugh about that, and I knew what your answer would be. So thank you. She's going for the Patriots. The Patties. I should have actually, yeah, go Pats. Go May. Hopefully he has a great game today. I don't mind the Broncos either. That's why I'm kind of, it doesn't matter to me who wins. Oh, Linda, there you are. Now my two wrenchers are here. Okay. No worries, Linda. We appreciate you being here. Linda and RM and Lucy are my blue wrenchers. They help with moderation. I took care of a lot of it today for you guys, Linda and RM. It wasn't, I think you're starting to set some standards and people are understanding. Kayla says, I have glaucoma and I'm on drops. Is there any way to get off the meds naturally? I don't know which type of glaucoma you have, open-angled or closed-angled, but it might be beyond where the pressure in your eye cannot be changed, but it would not stop me from trying a carnivore diet on it. 1910, thank you. Yeah, thank you for the super chat. We appreciate you, Dr. J. Jesus saves, and he's the great physician. He sure is. Rafi, R-A-P-H-E. He's the great Rafi. He's the great healer, right? That's awesome. I love that. Makes me wonder why he chose, not wonder, I know why he chose Luke, but Luke being the physician and part of the gospel, the gospels of Mark, Matthew, Luke, and John, and Luke being the physician and how he represents Jesus. It's just amazing. I love it. I just love it. And thank you, 1910, for sharing your faith. Well, Jeremy, that can be a question by a doubter, but when you are a Christian, the question was from Jeremy, what makes you so sure the Bible is reliable? As a Christian, God's word is the Bible, and to me, it's very reliable, and I believe that every Christian would agree. And, you know, that's your belief that, or maybe not, I don't know why you asked that question, but I'm assuming that you have doubt. When a person asks it in such a way as you did, what makes you so sure? I'm absolutely 100% positively sure that the Bible is reliable because it is God's word. Men wrote via inspiration the Bible. Men would never have been able to write that Bible without the workings of God. Okay. Virginia says, please remember me in your prayers. Recently had fibrosis. I'm guessing lung fibrosis. There we go. Added to my diagnosis of my lungs. 175 days on keto carnivore. Keep going, Virginia. You're in my prayers for sure. Thank you, RM. No, Jeremy, we did not. We understand you're not trying to be mean. We did. I can only answer for myself. I did not take it as you being mean. It's just, I was just trying to answer your question. It's inherent in me, and I think I can speak for other Christians, is that the love of Jesus is so inherent of us that we, from an apologetic standpoint, I don't need to prove that Jesus is real because I have the Holy Spirit in me. I know that Jesus is real. I know that the Bible is the Word of God, and it's almost impossible to tell me otherwise. My eyes have been opened since I was a little girl, and nothing could persuade me. Even if somebody said, well, you don't get mad at God, it's not getting mad at God, it's getting mad at a situation that has been allowed to happen, and it changes us. It's how you use that. It'd be like, Jeremy, you telling me that, how can you be so sure? I could either take that personally and react negatively, or I could share my testimonial with you, that how much God loves me and how he's got me to the place I am today. People would say, oh, I did that all on my own. And at one point in time, I might have said that I did everything on my own. I built this. Well, without me actually being born and made in God's image, I had nothing. There was nothing in my toolbox. In fact, I probably didn't even have a toolbox. Okay. So I give glory for what I have today, whether it be my house, my family, my job, how I get back and forth to the gym, my gym, everything in my life, I praise God for, because those are all blessings. And sometimes we ask for things that we shouldn't be asking for. And goes, you know what? All right, you asked for it. And I remember a time when I did this, when I was getting started with this social media thing. I prayed about this, okay? I prayed, God, if it's in your will, multiply my follow. This is when I was trying to figure out how I was going to go from in office. My nurse told me she's retiring. And I was in a place where, am I going to hire a new lady and be miserable trying to train her? My nurse of 14 years says, I want to retire. So I started this social media at the suggestion of a friend saying, you're really good at teaching. You love to teach. You can do this, and I think you can make a living. It would be where God would place you. Just pray about it and see if that's where God is leading you. And it felt so real, you guys. Like, oh my gosh. Yes, The Case for Christ, Melanie, perfect example. That's a great book. Oh my goodness, yes, The Case for Christ. I have many other books on apologetics that I could share with you. But when God was putting me in this, I was on the fence on what I should do. During this time, I said, God, if it's in your will, can you multiply my listeners and followers? I don't know if it looks like doubling them, tripling them. And so, what was the answer? The answer says, I'm sure this is what he said. No, I'm not. I get the impression this is what he said. Are you sure? Are you sure that's what you want? Well, I didn't know that's what I heard until after the fact. So as I was praying for this, please multiply my listeners and multiply my thumbs up and likes and all these things, right? Human acknowledgement, human validation, the likes, the shares, the questions. And so probably within a week, God answered my prayers. He multiplied me. I had a video, a reel. It was a reel. It went viral. I'm talking viral. Million views, maybe 1.2 million. It was a lot. Views right now, well, it doesn't matter. They're not that much. Yes, I got followers. Yes, I got thumbs up and hearts and the whole 9 yards. But I'm going to tell you something. What came with that was the most opposite of validation that I could have ever been exposed to. The comments and the questions and it was just really an unbelievable experience that I did not know that so much meanness and evil could be out there until that reel went viral. And I had a talk with God, and I said, I can't do this anymore. I think maybe I should quit. This was really early on in my getting started, you guys, when this reel went viral. And I said to myself, I can't do this anymore. I can't handle these people. They're being so mean. I'm too sensitive maybe. I can't do it. And what I heard back was obedience. Is that when we ask for things, sometimes we're going to get trouble. We're going to get tribulation. And boy, oh boy, did I get trouble. And I heard, if you're obedient, I'll get you through it. And sure enough, I got through it just like everything else I've gotten through in my life, as long as I rely on God. Okay? As long as I rely on God, so I give him the glory. Yeah, Linda, I think Jesus is testing you daily, and miracles are real. It makes me giddy about life. I agree. Yeah, it's pretty cool. I think I missed something in here. I thought there's, Tim, tell me about oregano oil and black seed oil and why it's amazing and for so many different things. Can you share with us? Phil, we'll put you in our prayers. Phil says that he's a depressed truck driver, but we will put you in your prayers, and hopefully that you will reach out and find some relief from a therapist to talk through things, okay? And personal testimony are great, but they don't show actual evidence or proof is the only issue. Again, maybe reading A Case for Christ might be in your best interest, Jeremy. When you're in doubt, which I can understand. I mean, when you look around and you say, I need evidence, and you look around at our world today, I can understand where that would get you wondering, is there really a God? And you could say, well, I could hear your testimony all day long, Dr. Jensen, but it means nothing to me, or I'm happy for you, but it surely isn't showing up in my life, because what I see is not a reflection of what people talk about Jesus' love. And I understand that, but I would also say to you is that what, Jeremy, you're looking at in this world is this world. This world is Satan's world. This isn't, we're, as a Christian, I'm taught, or I'm encouraged to live in this world, but not of this world. I live for Jesus and heaven. And so this world is somewhere where I do the work of Jesus. I am a servant of the one true God. And so everything I do, if I give it to the glory of God, I'm not giving it to the glory of me. Doing things for me is I'm the God. And I'm not the God. There's one true God. And when I see all of the evil in this world, I just keep praying. I keep praying, and I hook up with people who are Christians and who can pump me up, because we all get down. And the fact that you look around, Jeremy, and you say, yeah, you call yourself a Christian, and I've seen you be really, really mean to somebody at the grocery store, and I would say, you might have, okay? Because we are not perfect. We are made in the image of God, but there's only one perfection, and that's Jesus. And the only way we become perfect is when we are separated from death and we're with Jesus. Okay? To be absent from the body is to be present with the Lord. When I'm absent from this body, I want to be with Jesus. The alternative is to be in hell. I don't want to go there. I don't like what it has to offer. It offers me nothing. I know what Jesus offers in heaven. It's eternal life. And I'm going for that. And while I'm here, I'm going to be the best I can be to this body that was given to me by my creator, same as your creator. Everybody was created in his image, whether you believe or don't believe. Everything you have, your body, is a shell that could house the Holy Spirit. Mine does. I've accepted Jesus as my Savior. Okay? So I try to take care of this body. I don't want to give it crapola food, which is not really food. It's just crapola. I don't want to feed my body crapola. I don't want to experience toxic music and toxic movies and toxic people and toxic atmosphere. I don't want to experience that because that puts me in Satan's world. And I want to avoid those things. So I'm living in Jesus's world. Okay? So I look around just like you look around and I see evil, but I know what it is. It's Satan. And it's Satan's minions. And there's a lot of them. And sometimes it gets overwhelming. But then I focus above. I raise my eyes and I look above. And then I go to the Melanies in the 1910s and the Virginias and the Lindas. I go to them and we go, okay, we get in a little huddle and we say, okay, we're okay, we're okay. And then we bring God into our circle and we pray and we do our thing. And then, whew, I feel better. But it's easy to get overwhelmed in this world. We are human and we are sinners, everybody. And my goal is to avoid sin as much as possible. And sometimes that means avoiding people, avoiding situations, avoiding a lot of things, okay? I could go on, but I'm belaboring it. And we're gonna, those who are in Jesus, please pray for Jeremy. Okay. Yeah, Philippians 4:13. I can do all things through Christ who strengthens me. Thank you, Virginia. Oh, you guys, that is my signal to call it quits today. I don't know if you guys heard that, but that is my boy Talo. And Talo doesn't know how to bark. I think he's got part Basenji in him. So he is not a barker, but he has this kind of a howl or I call it singing. He sings to me and he just told me that he's got to go to the bathroom. So it's been a little over 2 hours and I'm going to take the pups out in the frigid air as I bundle up. And I appreciate everybody being here. Lord willing, I will be back next Saturday. If you have any questions or want to do a consult or want lab suggestions, email me at IronLadyDoc@AOL.com. Please share this. Make sure that you've already subscribed. Share the videos. Click the thumbs up and the likes and the hearts and all the clickety-clack stuff. And let's, maybe one of your coworkers or your family friends would benefit from listening to this, okay? So you guys have a most wonderful and blessed Sunday. And watch some football maybe, if you like that, okay? See ya.